are so happy. We have a great day scheduled for you all on today. We have Dr. Spigner in the room with us and Dr. McCroy, and we're really looking forward to the information they're going to be sharing with us. But before we begin, I wanted to give a few moments to introduce Heidi Staples, who's the Federal Project Officer for the National Child Welfare Resource Center for Adoption, and also at the Children's Bureau. And the Children's Bureau, as you all know, are the sponsors for the Mr. Microphone. The Children's Bureau, as you know, are the sponsors for our Minority Adoption Leadership Development Institute. So I wanted to give the opportunity for Heidi Staples to come up and give us an official welcome.
Thank you, Natalie. Hello, everyone. I just wanted to say that on behalf of the Children's Bureau, we're just so pleased and excited to have all of you here. And as Natalie said, the Children's Bureau funds this, and it's funded through legislation because it's really, really important. And it's an investment, really. It's an investment in future leaders, and it's an investment in our country, and it's an investment in hope for our foster children who need to find permanency. And so it's very, very important that you all are here and that you all carry your work back and do wonderful, good things. So I had my little saying for the day. I like to find little sayings. The greatest oak was once a little nut who held its ground. So I know you think I'm calling you a bunch of nuts, but there are worse things to be than a bunch of nuts. So, you know, I think it's good sometimes to think outside the box, push the envelope, be creative, do things that haven't been done before. And we're really counting on all of you to do that. And it's the kids. You know, we have 129,000 children waiting for adoption. And we have almost 500,000 kids in care in this country. And it's really a crisis that needs a national response and a response on behalf of all the states. Now, part of what the Children's Bureau does, as many of you know, is sponsor a national recruitment campaign to try to help children get adopted. And in addition to funding the wonderful NRC for Adoption, who we love and adore, we also fund Adopt Us Kids and a national photo listing website. So I hope when you get back to your states that you will bring attention to these resources that are sometimes underutilized. And I would also like to challenge you to help us because it's really been a quagmire and a dilemma for us. And that is that we have this national advertising recruitment campaign, and I'm going to show you the latest commercials that we just made this year, which we're focusing on teens because there's such a big need for teens. But the problem is that when people call, they call the Adopt Us Kids website, and they get referred. Then, if they don't already have a home study, they get referred to the state or the county office. And then they call, and they often are met with, well, you know, we don't place out of state, or we don't like to do that, or we like to look for homes first for a year here, or we don't share our families with other states. These are the kinds of responses that people are getting, and it turns them off. So it doesn't make much sense then to spend millions and millions of dollars working with these wonderful advertisers in New York, the Ad Council, that is you know what they're doing. They have these award-winning commercials. Then you have these commercials, and people call, and not only are they not welcomed, but they're really turned away and discouraged, and they get turned off. The other thing that's a national trend I just want to mention is that the Hague, as many of you know, the Hague Treaty passed. And that is going to tighten up adoption in foreign countries. And of course, adoption is a wonderful thing no matter in what venue or how it happens. But people who in the past might have gone out of country are now going to come to the States. So these are going to be maybe some different customers. And we're going to have to think of them more as customers and have a customer service focus. And so we need to welcome people in. When people look at the Adopt Us Kids website, the kids that are on there are usually older kids or harder to place kids. So by virtue of the fact that they're expressing interest from the website, it means that they're already willing to take children who are older or may have special needs or may be in sibling groups. So even if they express an interest in a child who lives, say, say in Idaho and they're in Tennessee, by the time they finish their home study, those children may not be available, but we need to welcome them in the door. And when we welcome them in and we do their home studies, they may very well end up adopting a child right in our own state, or maybe not. But if we all have this shared perspective that these are our kids, and we have to find homes for our kids, not these are my family, so I have to hold on to them. I mean, I appreciate there's a lot of work and there's resources, but it's really a dilemma for kids. And if we all work together and work out the infrastructure problems and the issues that make it difficult to place in between states, and part of that is having relationships so you can pick up the phone and call each other and say, can you help me work this out? We think we have the perfect family for these kids in your state. It shouldn't be easier to go outside of the country to adopt than to adopt in the state next to you. But that's kind of how it is. So anyway, so I just am throwing down the gauntlet there that I want you to go be these great oaks and go out and help us with this interjurisdictional issue. And again, I'm really, really thrilled and excited. Can't wait to hear the presentations. I remember how impressed I was at the last MALDI. And I'm just thrilled to be here. So hopefully we're going to be able to show you the 3 TV ads. And thank you very much for having me here.
Pull your face mask down. All right. What about the chest guard? It looks loose. Is it loose? All right, what about the shin guards? All right. Okay. Here comes the heat. Bring it in. Bring it in. Good hustle.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who would love to put up with you.
Horrible. Hey, yo, that was not my fault. That was his fault.
His fault? The running back ran right past you.
We are gonna rock this.
Okay, guys, you ready for the big game?
Dad, did you do the laundry?
Yeah, I used the fabric softener. Let's go.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who would love to put up with you.
How's everybody doing tonight?
Hello.
Chrissy, hey.
Hey, Alex.
How are you?
Alex? Alex?
Oh.
Hello. I'm Mrs. Garcia. We've heard a lot about you.
He is cute. Stop.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who would love to put up with you.
Anyway, have a great meeting, and I'm glad to be here. Thank you very much.
Our first faculty member for the Institute and presenter is Dr. Carol Wilson-Spigner, and she's asked me not to read her entire bio, but I will tell you it is extensive and very impressive. She joined the University of Pennsylvania School of Social Policy and Practice in July of '99 as a visiting professor and joined the faculty permanently in September of 2000. And there she directs the social policy program and teaches policy and macro practice. And how much more do you want me to say about you? That's enough? That's enough. She asked me not to read it all. But I will say today her session is Change from the Middle, and I know that this is something that as emerging leaders that you have all experienced, and you will benefit greatly from her presentation because she speaks to what is your day-to-day challenge as leading and managing from the middle. Dr. Carol Wilson-Spigner.
Oh gosh, you guys are bright this morning. Who are the MALDI fellows? Hands up. Hands up. Yeah, okay. Okay. There are lots of folks here that I know, and I am delighted to be here. I think that one of the most challenging things, no matter where you sit in a complicated organization, is trying to figure out how to influence it. And the thing that always strikes me when we think about change is that often, no matter who you talk to, they don't feel especially powerful. Okay, I was reflecting yesterday on a group that I worked with. Sorry. That's okay. Am I wired up now? Okay. I was reflecting yesterday on a group that I worked with for a number of years, and the group was composed of child welfare administrators, juvenile court judges, and leaders of domestic violence agencies at a state level. And everybody felt powerless. And one of the things that I think is really important is for each of us to really understand our ability to influence change. And sometimes when we get embedded in complex organizations, whether they're public agencies, whether they're the university where I teach, it feels like it's really tough to make change happen. And so part of what we're going to be talking about today is a set of ideas to help you think through how you use your position, your expertise, and your leverage to make things better. I want to start by asking you to think for a few minutes about the agencies you work in and how you would like them to be different 5 years from today. So take a few minutes and think about your agencies and identify what you would want to be different 5 years from today. As you think about where you sit and the things that drive you up the wall, what would you want to be different? Take a few minutes and think about that. And then I want to just hear from folks about what they would like to be different. Okay. Everybody have thoughts about what you'd want to be different? Okay, let me start with the MALDI Fellows. What would you want to be different? Anybody? Yes.
I was really thinking about this question because what I see is that we're not doing enough succession planning. In my agency, the leadership is quickly moving on to being able to retire, and we're not preparing people early enough to take on leadership positions.
Okay, so you want to see a continuity of leadership in the organization that you're in. Okay, who else? Yeah.
I would really like to see the workforce reflect the color of the community that we're serving.
Okay. So you really want the workforce to reflect who gets served here. Who else?
I think just general communication all the way throughout the agency from top to bottom. It seems as though decisions are made behind too many closed doors without the right input and the right people to help make those decisions.
So you want more inclusive communication and decision making?
Absolutely.
And who do you want included?
Well, I think it has to, those decisions have to include not only the people who have the authority, but also the people that will end up impacting.
Okay.
And so if you can't have people who have the authority to make decisions without the people who actually those are going to directly impact. So I'd like to see community and internal decision-making processes.
Okay, more community involvement, more frontline involvement.
And even internal, I mean, even worker involvement to higher staff involvement. I think that, again, that it just seems like there are many decisions that are made that internally that are rolled out, even just straight initiatives that are rolled out that, that when it gets to the ground level, folks are saying, what's going on? No one, that this doesn't work.
Okay. Okay, great. Thanks. Who else?
I guess I would like to see, and it's something that we're currently working on, but I don't know how fast we're working on this. I would like to see us change the way we work with and view relative caregivers.
Say another line about what you want changed.
I guess what we're aiming to change, or what should be changed, is perception. The relative caretakers, the perception that they have about our agency and the way that we do things, and also us as an agency, or our perception as the care that the relative caregivers can give to the children, and the assumptions.
Okay, so it sounds like you want a really different kind of relationship.
Yes.
Between the agency staff and attitude toward relatives and the reputation the agency has with relatives.
Yes.
It's really a transaction.
Exactly.
Okay, great.
I guess for me, what comes to mind is not being an agency that's reactive, and by that I mean whenever there's a circumstance in the community, we go about our work in a crisis mode, so that we just react to whatever has happened as a result, instead of going about our work in a consistent way so that we don't have to be reactive.
Give us an example.
Unfortunately, last year, Connecticut was faced with a situation where there was a fatality in a foster home, and the individual was a staff member of the agency. So that now it's caused a complete change as to how we process our licensing for the staff members within the agency. So that, again, they weren't treated any differently. There's no different process for them, but as a result of this fatality, they're now going about the licensing in a very different way for them.
Okay, okay. And let me just ask you, is the new arrangement better or worse?
We don't know yet. It's just coming up to be. However, the individuals will still be supported by our agency, but licensed by private agencies. So the connection is still there, if you will. The insinuation is that we process our staff differently as far as the licensing is concerned, but we're still going to maintain them as adoptive and foster parents on our side. So.
Okay, great. Okay, other changes you'd like to see?
I'd like to see our agency work on retaining trained staff.
What happens to staff? Okay. And what does that do to the organization?
A lot of them, it's the workloads that they have to carry. A lot of them I feel that are not fully trained, and so a lot of them just can't carry the workload that they are responsible for. So they're burned out, and they continue to move on, which is not good for the children that they're working.
Okay, okay. So you're seeing part of the issue is readiness, part of the issue is turnover, part of the issue is impact on kids.
Yes, it is.
Okay. Anybody else? Okay, let me ask our mentors what they would like, our mentors and our senior leaders, if you will, what they would like to see that's different.
During our budget crisis, I'm interested in seeing more dollars available for services.
So you want... Okay, increased funding for stability and for services.
And for services.
Okay. Who else?
Good morning. I'd like to see more focus on outcomes and less focus on compliance.
What happens when you focus on compliance?
You have a stressed out, burnt out staff.
Okay.
Who start to lose focus of what the intervention is all about. And in our system, there's a lot of lying going on, people falsifying records because they're afraid that they're not meeting the measures, and it's less about what's happening with the kids. It's more about meeting the numbers. And there's a place for numbers. And I think it has improved the system to look at numbers and have numbers sort of inform practice. But it's a danger when it becomes the end-all to be-all. And folks are just concerned about their livelihoods and not focused on the interventions on behalf of kids.
Thanks. Let me make an observation. Of the things that were identified that you would like to see change, it took us 2 pages to get to results. Okay? It took us 2 pages to get to results. And I don't want to suggest that the things that are listed are not important, but they're not going to be important unless they're linked to results. Okay? And so a lot of times, those of us who live and thrive in bureaucracies get really focused on the process, and we don't connect it to the result. So that I think one of the really important things is relative caregivers for what result? Funding for what result? Okay, staff retention for what result? That one of the dangers in living in a bureaucracy is that we change processes all the time, but we don't connect it to results. So just be thinking about that, because you want to ask the question, if I change this, what is it going to get us in terms of results for kids and results for families? Does that make sense? I see heads nodding. Okay, we get to be real specialists in the process and not always focused on what difference it made. So we should always be asking the so what question. Okay? Okay, who else wants to put something on the list now that I've beaten you up? Anybody else?
I'd like to mention that I have a laundry list, but let me just give you a couple. One, I would like, I would like to be able to assist guardians in adoption so that those children that go into this so-called permanency of guardianship can actually be adopted when their grandparents say, you know, you're my child and I want to make this a legal permanent adoption. And at this point in Arizona, that's not an option without them going through a private attorney or private adoption process.
Okay.
So greater permanency, actually, for those kids.
Okay, and in a way, you don't want to lose the option of legal permanency just because there's a guardianship arrangement.
Right.
You want to be able to move it when the family's ready.
Exactly.
Okay.
And the other one, change I'd like to see is I'd really like to see youth participation in selecting a foster and adoptive home. I think it's important that those youth are able to identify, help identify the home that would meet their needs culturally, emotionally, and have some input on that. And I think that might contribute to better stability.
Okay. Let me ask you a question on the youth participation. Where is the obstacle to youth participation in selection of families in your organization?
Bias and time.
Okay. Say a little bit more about bias and a little bit more about time.
I think we are used to, I think in our organization, we feel the need to help our youth, and I think that is a shared feeling. However, I think we feel that in order to help, we need to be expert on what's right for that youth. And I think that youth may be expert on what works for he or she. So I think we have a bias. I think we have an ego attached to our profession as case managers, as supervisors or professionals.
So we're the experts, and they certainly wouldn't know anything about their own lives.
Exactly.
Okay.
Right. And in terms of time, I think it takes time and resources. We have to pick the youth up from that that group home or that shelter in order to transport he or she to wherever, the family's files are. We need to go there and spend time with that youth and get to know that youth and what their likes and dislikes are. And I think that's just a resource issue. Oh, it's probably greater than a resource issue, but it's definitely a resource issue.
Okay, great, thank you. One of the things I want you to be thinking about as you think about change and the kind of change strategies is where the obstacles to change exist in your system. It becomes really important to figure out, is this a practice issue? Is this a resource issue? Is this a policy issue? But part of figuring out how you bring about change is really figuring out where the problem is. Okay? So as you think about each of your individual issues, is this a policy issue? Is this something that's prohibited by law? Is this a set of decisions that somebody upstairs made? Or is this something that could be done if we orchestrated ourselves and our resources differently? Okay? Yeah.
I also think that the role of fathers in child welfare is something that we must pay much more attention to. And I know that that's a historic and systemic issue in child welfare as a whole throughout the decades of time. And just to be able to recognize that fathers have a role and presence in their children's lives, whether they're putative, acknowledged, legal, or otherwise. And that's a passion of mine at the state level. I'm involved with the Ohio Fatherhood Commission, so I'm just taking that one on wherever I go to say to child welfare practitioners that we have to conduct business differently and to recognize that fathers do play a role, a very critical role, that may even avert adoption and foster care if we allow the search for paternal relatives and supports whenever necessary.
Absolutely, absolutely. We need to allow children to access all of their familial resources. Fathers, mothers, mother's family, father's family. We've been treating children as if they only have one parent, and that's not factually correct. And so that exploration becomes really important. Okay. Yes?
Greater voice. A greater voice. We operate from a mode of being transparent, such that there are no secrets within the department that were visible to the community. But with that visibility, we seem to lack voice or lack a clearer, strong voice. That ties with some of the things that have already been stated. You know, our voice is there, but it's in a reactive tone. It's more of sometimes defensiveness. It lacks, I think, being informative and educating the community and those that we're trying to be transparent to, so that we're always having to answer for our actions as opposed to perhaps informing folks as to, what the business is about and why we do it the way we do. And not so much explaining that from being defensive, but just educating and informing. Legislatures don't know child welfare. The community at large doesn't know child welfare. We explain ourselves once the press gets information. That's not educating. That's being defensive and trying to be accountable for taxpayers' dollars. So I wish that our voice had more strength and clarity about the work that we do. In the funding end, I would like to see increased funding, but I also would like to see more attention given to the distribution of the funding and the resources and how that works. I don't know in some areas that the funding lacks so much as how it is used.
Okay, great. Thank you. One more.
Is this thing on? I'll just speak loudly. I would like to see a conversation about the 50,000 children to be adopted every year barrier. I remember when I was with the state, and that was more than a decade ago when we started talking about 50,000 kids and how difficult that
1993.
was. Yes, long time ago. We reach it and we stop. Or we might go to 52,000, 51,000. There is a barrier there. I think it's a national mindset, but we need to sit and talk about how to break that barrier. And I don't have a sense of how to do that, but I think that we need to actually attack that. Maybe reset the barrier. I know with soon-to-be Secretary of State Hillary Clinton's ideas on, she wanted to double that barrier, to more than double it, to 110,000 a year. And some of the papers that she issued about adoption during the election. So there has to be some way for us to increase these numbers nationwide. And but I think it's going to take some very learned discussions on not only what, but how, and the will, and bringing in all of the bias that we have as well.
I think that's a really interesting issue because, in fact, what we have is a system or policy-driven goal and not not based on children's needs. So when Heidi tells us we have, what, 129,000 children with a goal of adoption, but we have a 50,000 per year goal, we're not ever going to catch up. Okay, and so the question becomes, what drives our goals? Heidi. Absolutely.
And why can't we pour resources back into the families? If they're going to age out and go momentously, I think that we really have to think about, I think Ada's right, and it's a combination of approaches that we have to really think about what makes sense for kids.
Okay, great. I'm gonna stop this part of the discussion because I think we've made a unanimous case for change. That this system is not really meeting the needs of kids. We've made a case for better results for kids. And we've made a case for a series of internal changes that has the potential to get us to those results. So I want to go to the last question here, because we've answered the first two, which is really, what kinds of questions do you guys have about affecting the kinds of changes we've talked about? None? You got it nailed?
I think that one of the things to really affect change, you have to have a different level of ownership about the problem. And that involves community engagement.
The children aren't just my state's children or your state's children, they're our children. And our means not just human services or social services or job and family services, whatever your agency's name is. It's everybody's child in that state, whether it's a legislator or a local community activist. It's everyone's issue. How we deal with families, how we support families before they ever come into the child welfare system, and how we support families going back to being a family,
in a different way. We undo families pretty good. But how do we build families and support families so that we prevent the issue of 129,000 children waiting for adoption? I do believe that's an engagement issue, engagement at many levels. Law enforcement, engaging the schools differently, engaging the community differently, so that the community is responding in a very different way than it has been historically.
Okay, so you've raised a question about how do we share this ownership and how do we do better family building. There's a comment here.
I'm a consultant for JBS as a Child and Family Service Reviewer, and I'm impressed by that process. I've done 8 states and seen a lot of, had a closer look at, sort of how the practice in the state is going. And I'm wondering what impact the CFSR process will have on raising the standards of practice and making more consistency across the nation.
Okay. Now, let me tell you what my question was. That's a great question. My question was, what questions do you have about making change? Oh, okay. Okay, okay. Now, everybody got my question? Okay, let's focus on my question. Okay.
I think following up on what Sharon was saying is that the relationship between public agencies and private agencies is so contractual, but it's not collaborative. So that if, for instance, my agency has a lot of contracts with the different county agencies in Pennsylvania, but then you're under their mandate, so there's not equal voice on some of the decision making on the placement of children, the matching of children. It's all still relies 100% on what the county then makes that decision, and we may know the kid, we may know the family, but we're not part of that decision making. So to move it to more of a collaboration and a joint sitting down of that process versus just contractual and you just do what we pay you to do.
Okay. And what is the change question?
The change question is, I think in order to make change and to expedite or increase the placement and the permanency of children, then the change question would be to change that relationship so that there's an equal voice in the process so that we can move these children to permanency.
Okay, great. Thank you. Yeah.
My biggest concern about trying to make that change is what data my management is going to look at to decide where we're going and what outcomes we want, because invariably to me, and it even makes me nervous with the CFSR, makes me nervous with some of the outcome measures even at the national level, that that data is going to drive some of our processes. And I am just adamant, and have been, that I think data can drive you to where there's a possible potential area of excellence or potential problem. But I do not think that data can tell me quality. And that's where I get nervous about trying to affect change, when to me sometimes we're using the wrong data. And I can, in our state, in Florida, we have this wonderful measure about, and I can't even remember the day, the number of investigations, the percentage of investigations completed within 60 days. Mm-hmm. And without looking at the recidivism of those that come back in 3 or 4 months, mm-hmm. I don't care if you finish it 99% of the time. If we got another report in 60 or 90 days, I would say we don't have quality. So that's my question. What data are you going to have to try? What data are you going to look at? Are you going to look at quality? That's what makes me nervous.
Okay, and I would suggest to you we need both kinds of data. We need quantitative data and we need qualitative assessment of the work. we also can't rely on singular measures. I think you articulated the notion of an investigation and recidivism, okay? You can't rely on a single measure because the outcomes are interdependent. The measures are interdependent. So when you have this whole data question, you can measure production, but you also have to measure the quality of the product, okay? So your point is well taken.
I have to be careful here, but
don't be careful. We'll
okay,
keep
y'all
it
don't
in
tell
the room.
on me. Don't tell on me.
We'll keep it in the room. Will we keep it in the room?
Right.
But it might be on YouTube.
Oh, that's right.
Do you want them to stop taping for a minute?
Well, let me just say, no, I just want to say that I think that we have a number of different initiatives. We have various leaders with different visions when it comes to child welfare. But I do think that it is hard to change a culture of an agency. And so many times, even with a new initiative, you have the same individuals responsible for implementing that initiative. So my question is, how to impact their perception, point of view, their their culture, and I guess worldview when it comes to serving the needs of children, when it comes to making financial decisions, when it comes to making decisions on the field, when it comes to making policies that reflect a new vision and a new practice. Many times it is made with very experienced individuals, but that may have stronghold beliefs when it comes to our practice.
Okay, great. Changing the culture of an organization is one of the most complex things, complex challenges facing us. And in a real way, you almost need to focus on changing the behavior, and the rest will follow. But we'll talk about that in a minute. I want to shift and start to go through these set of ideas about change. I want to talk a little bit about how you lead when you're not the formal leader. Okay, how many of you in this room are the head of an agency? Okay, we got one. That's terrific. Most of us will have to influence change without being in the leadership position. So I want to talk about that. I want you to really get a feel for your sources of power, because most of us in this room have informal power, not formal power, but we need to know how to use it. I want to look at the change process and leadership, and we're going to try to do all of that in the time we have left, just to give you a way of thinking about how you move some of these issues that you've identified. So let me start. I'm going to skip this, but I want you to think about this. We're not going to discuss it, but I want you to think about it. What has been your greatest accomplishment in terms of impacts on the adoption or child welfare system? I want you to think about what you needed to know to bring about that change and what skills you utilize. And I want you to be thinking about that in the background. How many of you feel like you've had a great accomplishment? I'll put your hands up if you feel that way. Okay, that's part of why you're here. Okay, and let me just ask you, what skills did you need to use to achieve whatever you achieved? What kinds of skills? Anybody?
You know, I had to change the form of communication that I normally use with my day-to-day work. When I'm dealing with my clients, because I'm a case manager, when I'm dealing with my clients, just the terminology that I use is different than from when I'm sitting in front of my superiors and speaking to them. trying to get them to see what I see on a daily, sitting in Mrs. Jones' home on her couch, trying to give them the vision of what Frontline does, because they're so removed. You know, they say that they have done this years ago. Oh, I did what you did years ago. Times are changing. It's no longer years ago. You can't sit down on Miss Jones' couch and say, can you tell me about your intimacy between you and your husband, and not get cussed. So, so trying to get them to understand that certain questions you just don't ask people anymore, especially people who come from very private homes. They'll give you the look like, no, you didn't just ask me that, but yet it's on every questionnaire that we have, and why is this not asked? Or why do I, when I read your reports, it says she refused to answer those questions? Well, it's a different culture now. So the way that I speak to Ms. Jones, again, is very different than the way that I would speak with my superiors when reporting back.
That's great. It's a great example of strategic communication. That one of the most important skills that you need to bring about change is the ability to talk to different groups about the same issue in ways that they can hear it and in ways that are consistent. So strategic communication is an important change skill. What else? What other skills?
Team building.
Okay. One more sentence.
Well, just identifying what people can do, and also identifying ways that they can do those things. Identifying the opportunities for people to get in the game, for people to get involved, and it's not one person's thing, but it's all of our responsibility. And so being able to rally the troops, if you will, and charge on toward a goal is what's been important.
Team building skill is really important. Those of us who are people of color often feel like we have to solve it ourselves. Okay, and often, and I'm speaking from where I sit, often we feel like we have to fix it, and we don't engage other people in the process, and then we end up feeling overwhelmed. So team building is not just, it's a survival strategy as well as a change strategy, getting other folks in the game. Another skill.
Could you repeat the question again so I can make sure I answer the right one?
What skills did you utilize in achieving your success?
I'm joking.
No, I appreciate it. One of the skills is understanding the question.
No, I happen to be a training director, and what I did was I capitalized on my folks coming in and tried to change the culture that way. So somebody talked about changing the organization and the mindset, and some folks don't want to change, and they're not in a place to change. Right. So I tried to impact the area that I could impact, and that was the young minds and the folks that were coming in, and then their supervisors, and trying to change the culture within my control.
Okay, okay. So focusing in on your span of control and trying to influence that was really important. So that's a targeting question. What other skills? Yeah.
Interpersonal skills.
Be more specific.
Just knowing how to approach people and making folks feel comfortable in the space that they're in. Some of the basic tenets of social work, meeting people where they are. Knowing how to embrace the language that they use, to present in a non-threatening manner, to know how to diffuse, know how to diffuse controversy.
Okay, good, good, okay. Yeah, one more.
In my current role, I also oversee child welfare policy at the state level. And I believe one of my greatest impact has been the ability to utilize the skills of legislative analyses and being able to impart that knowledge onto the practitioners, having them be a part of that process, because legislators don't know child welfare. And so to be able to take a bill, tear it apart, do whatever we have to do to provide that necessary impact and input in the process, I think has been one of my greatest skills, of being able to say to the child welfare community, here's a bill at hand. I say this to my regional training centers, take a look at this, dissect it. What will that be for your community? How will it impact us as a state, et cetera? So just to be the ability to penetrate and impact legislation.
Okay, that's terrific. And I teach policy, so I really appreciate that. But often, people at the front line don't understand the policy context in which they work. And that has to be translated. And we have to influence the development of that policy so that it really is a two-way street and we make it work for kids and families. There was a comment over here.
Yeah, I think we've touched on this a little bit, but I really think building a trusting relationship is central with staff, with legislators that are child welfare focused, and with your superiors. And I think that goes a long way, and I've certainly worked to do that.
Up, down, and across. Okay. Yeah.
And actually, I think that the two of them have hit on an important piece. You don't need the credit for being the leader. If you can work in a team and let the team get the credit, even if you planted the seed that grew the tree, it's okay. Mm-hmm. If you go to the CEO and give them an idea and work the idea and make it happen, and they get the credit, it's okay. The point is, it's about getting it done. Mm-hmm. And that's how some of us get in trouble, because ego, the big I is in the way. It's a barrier.
Mm-hmm. If I'm your boss, I want you to make me look good. That's right. Okay? And I want to share the credit. Okay.
One of the things that I think everyone's talking about a lot about what we would like to see done, but one of the things I think that we're not hitting on that's I think key is listening, because we want to hear what people are saying to us, not the fact that we want them to say it. That doesn't mean anything if we're not hearing what they're saying and being able then to internalize it in order to make some changes.
Okay, terrific, terrific. One more.
And I think that, you capitalize it for me, because the hearing, listening, that when we are at the table as policymakers, that we are policy engagers, and when we hear what constituents are asking for, when we hear what our staff are saying are the problems, that we take that information and we use that information to help shape the direction. When you're sitting down with legislators and they say, well, I want to enact this piece of legislation, to hear what is the reasoning, what's the impetus for them wanting to make the change, and that in listening to that, they might be going in the wrong direction with the language in the bill. And so if you're really listening and keying in on that, well, then you can help educate and help them fine-tune that piece of legislation so that you get good policy out of it, because you get good legislation. There's lots of bad legislation out there. But if you really are listening, then you can help guide the forming of that, drafting of that legislation, and get good policy and get good intent and get good practice, hopefully.
That's really important. Let me just say, I think it's easiest for us to talk to people who agree with us, but people who have very different positions and perspectives, it's not so easy to talk to, but we got to get to the level of goals and intention. If you can get to the level of goals and intention, sometimes you can work out the compromise that gets you where you need to be. So I really appreciate that. So let me, I want to talk about power. Power is simply the ability to influence. It's the ability to influence the decisions of others, the behavior of others, distribution of resources, and actions, okay? And you don't have to have authority to influence. And that becomes really important. Formal power is positional power. It's being the leader of the institution. It's the ability to give a promotion or to suspend somebody. Okay, that's formal power. But most of us operate from a base of informal power. And the sources of informal power are expertise, and everybody in this room has a different base of expertise. If you've done a lot of frontline practice, you know a lot about your kids, you know a lot about your prospective families, you know a lot about the community. That's a base of expertise. You may know a lot about other systems. That's a base of expertise. But informal power is based on expertise, and it's based on something we call referent power. And we've been talking about it when we talk about relationships. It's about the ability to connect and engage others. Okay, so if you don't have formal power, what you really want to do is extend your expertise and extend your relationships, because that's the manner through which you begin to influence others. Now, this is a really important set of questions. Do you guys feel powerful? How many of you feel powerful? 1, 2, 3. To a certain extent, some days. Okay, let's do, who said some days? Okay, speak on some days.
I think that there are opportunities, and I walk through that opportunity. That door's there. It's like, this is the time. This is the opportunity. I might have been thinking about this and thinking about it. It's like, oh, okay, when people influence, this is the moment. Seize the moment and take action. And because of that, then things happen. Other days, it's like, you couldn't move a pebble if I kicked it hard.
Okay.
And so some days it's like there's just a stream, it's a flow, and it's just move with the tide. Don't miss that moment and just go.
Okay. So this is the issue of grasping the opportunity and being ready when that opportunity presents itself.
I think being a part of this movement, being a part of MALDI, has been inspiring for me, and it has given me that voice that you're talking about, because it's something that is, I chose a piece of the project to work on that's very near and dear to my heart, and also that needs to change within our agency. So, getting into this, I really dove into it, and, when somebody asked me how I felt or how things are going, I took that opportunity and spoke about it. I did that elevator sentence. You got 5 seconds to tell me about the project, and I gave it to you, So,
good learning.
Good learning, right? So I think that is the power right now, because when we come back from this and we report to our agencies what we've learned in the presentation, my next question to them is, okay, what are we going to do with it? Mm-hmm. Because if we're not going to do anything with this, what was it all for? Because we've done our research, we put things into action, we see that either this or that does or does not work, but are we just going to drop it? So that's where the next form of power is going to come. Do I have the power myself to put those things in action? No, I do not, but I had the power to show that it worked. So
okay, and I'm going to suggest to you, you have the power to seed the environment. That instead of assuming that it is a hierarchical decision, you may need to be having a whole lot of elevator conversations to begin to sensitize the organization to what you've been doing, so you're not the one campaigning by yourself. Okay? Okay, who else wanted to get into this?
Along the lines of what Tiffany said, my experience has been the same as a result of MALDI, and that is Quite often I feel powerless as it relates to the bureaucracy of our agency. However, what I have learned in speaking with my mentor is I have the power to change my immediate group, to have influence over them, so that if that's happening, then maybe it will trickle up and others will see that some of the changes that I've attempted to make have been able to come to fruition.
Okay. I think it's really important for us to, and if you haven't read it, read Malcolm Gladwell's book on the tipping point, because it's a really important study in change. And he talks about the fact that change is in the environment, that people like you are experimenting with new ways of doing things, and that change has a kind of contagion. And when it gets to a certain point, it then begins to spread through the organization. So his metaphor is the glass where you fill it, and you fill it just a little too full, and the liquid takes a crown, and then you add one more drop, and it just spreads. Okay, so as you think about change, your efforts, and it's like this discussion about seeding, your effort to influence your domain has the potential for influencing the people around you and beginning to create that kind of curve on the glass that sets the stage for spread. And so you need to be thinking about, what do I do in my unit? How do I share it with the people around me so they know what I'm learning? How do we create an environment in the discussion about what this means in the organization, what this particular change means in the organization? How do we create an environment in which we can have those discussions? Okay? So I want you to just think about just the kind of factors that influence your power and your own sources of power, formal and informal, and we've talked about that. We're talking ahead of my notes. Okay, when we think about planning change, we've got to figure out what the felt difficulty is. We've got to figure out who's most affected and what are the impacts that we want to achieve. That the problem analysis becomes very important. And I would add to that, we need to think about where the problem is located in the organization, whether it's in policy, whether it's in practice, whether it's in values and attitudes. We need to be pretty sophisticated about that. Planning change, you've got to be really clear about your goals. And I would suggest to you, you need to always relate your goals to the outcomes for kids and families. That, in fact, you may want to change the attitude and the approach to kinship care families. But you need to be really clear about what purpose. We want to maximize the number of relatives who can care for children on a short-term and long-term basis. But be really clear. And you need to, this gets back to the measurement question, how will we know if we've solved the problem? On the kinship care issue, will we know we've solved the problem when we go to kin first and we see an increased number of stable kinship care arrangements for kids? You've got to think about what the measure is, both quantitatively and qualitatively. Okay, in your change planning, it's really important that you look at what your alternative strategies are. One of the things I see again and again in child welfare organizations is that we have the strategy before we know what the problem is. No, I'm serious. We find a strategy that is a hot strategy, and we pursue the strategy before we've done the problem analysis and before we've looked at what are the alternative ways to get at the problem. So often we're really strategy driven rather than problem driven or issue driven. Does that make sense? There is a hot new idea, and we incorporate the hot new idea without thinking through why we need it, for what purpose, and what kind of result we have. So we have to be really careful, and it's true in policy as well as practice, that we be really clear about what the issue is and what we're trying to accomplish before we pick the strategy. Okay? We've got to aim before we shoot, if that makes sense. Now, the people who write about leadership talk about shoot, shoot, aim. But I think the stakes in child welfare are too high to be just pursuing strategy without being clear about what our goals are. Does that make sense? Okay, when you're thinking about alternative strategies, I think there are two questions that you need to ask. One is the strategy feasible? You know, a lot of us have great ideas that are totally unrealistic. Okay? And what impact are those ideas going to have? And I like to lay that out in this 4-cell grid, because where you want to go is that you want things that have high impact and high feasibility. You don't want to spend your energy on something that's hard to do and is not going to have a result. So you should, see, there's a conspiracy. Not that I'm a conspiracy theorist, but you need to be thinking about how likely it is in this environment that we can move this strategy forward, and then what result is it going to get? So that you're really focused on the high feasibility, high impact strategies. Things that you can do quickly or reasonably that are going to have good impact on the results. Does this make sense? Okay. I'm working with a group now that's developing a complicated set of recommendations. And as I begin to look at the recommendations, my charge is to say, are these reasonable? And are they going to result in the kind of change that we want? Well, that becomes really important. Feasibility may be about willingness of people to move. It may be about resources. It may be about the ability to sustain things. Impact is purely about the results. So we need to be examining that. In planning change, you need to think about what factors are really going to influence your ability to move forward. And there's this notion of readiness for change, that one element of readiness is knowing what to do. I mean, a lot of us spend a lot of time talking about the problem but not the solution. Okay? It's interesting, I was in a meeting yesterday and people were specifically asked to talk about solutions. They spent 90% of the time talking about the problem. And in the last 5 minutes said, oh, they told us to think about solutions. So we need to be clear about the problem, but we need to really shift our focus from there's a problem here to there's a problem and here's what I propose as a solution. Okay? Readiness for change involves leadership support. And I must tell you, it becomes really important when you're in the middle to sell your agenda up the system, to promote up the system and to get buy-in from leadership for the changes that you want to institute. Readiness for change is also characterized by the fact that more than you feel uncomfortable. that there's a sense of discomfort that's shared at a variety of levels in the organization and maybe outside and among a variety of actors. Network of champions, and this is part of creating the tipping point. It's really, somebody used the term engagement earlier, engaging other people and sharing the ownership of an issue. Network of champions are a group of people who are your allies in bringing about change. And you have to build that network. The last thing you want to do is get out on a limb by yourself. You can't do this solo. So you need to have allies in the process. And that means having those small conversations. It means vetting your ideas with a variety of people so that when you're ready to move, you've got allies that have your back in order to move forward. And the final thing is that whatever your change strategy is, it's got to be linked to the goals of the organization. If you can't explain its relationship to the intention of the organization, it's going to be very difficult to pursue. So you've got to be able to do your elevator speech. You've got to make your case as it ties to what the intention of the agency is. Does this make sense? Questions, comments, hysteria? Okay, I think it's really important to do a force field analysis when you're thinking about change. Well, I lost it, sorry. Okay. And have all of you done force field analysis, either in your head or actively? That's really about taking an issue and trying to figure out who's on your side with this issue or who you can bring in on your side. That's about building the network. And who's going to oppose you and why they're going to oppose you. Because you have to be prepared to increase the number of allies that you have, but you also have to be prepared to address the opposition. So you've got to be able to have a conversation with people who don't see the world the way you see it. Don't share your enthusiasm for your strategy. And you've got to know who they are. So just in thinking about a change strategy, you're thinking, who can I line up? And who's going to be problematic? And how am I going to manage the people who are problematic? And am I going to try to engage them? Am I going to try to isolate them so they don't contaminate this other group? Okay. How do I weight this so that my supporting factors are aligned in a way that I can move this action? This is pretty abstract. Does this make sense? How many of you have had to think about dealing with the opposition? Okay, somebody offer me a strategy. Tell me what you thought about and what you had to do. Oh, you had to listen.
It's worth repeating. I had to listen. And then I had to establish some credibility.
Okay, how'd you do that?
By understanding the issue, being knowledgeable about the issue when it comes to research and data.
Okay. And then what happened with the opposition? Were you able to engage them, contain them?
Well, I wasn't really thinking of one specific instance, but I was thinking about dealing with the legislature and a few legislators. And no, we weren't always able to influence them to the degree that we wanted to, but able to maintain a positive working relationship and with the legislator despite our different viewpoints.
Okay. And that's really important in the long term. Okay. But you can begin to see how this tool is useful. And as you begin to use it a lot, you just do it in your head. I mean, you begin to think about who's going to give me trouble on this issue and how do I need to manage it. Ada.
One example was including the opposition on your team. Having them sit at the table with you, understand the whole process. There was a time when I could not get dollars for something in Louisiana because it was our fiscal section that was opposing it. But once they sat at the table and started listening to what we wanted to do, the return of the benefit, what would happen, the good publicity, it worked. But all along I've learned I need to include the opposition on the team, and then we learn from them as well. I learned a lot about fiscal responsibility during those meetings as well. So there is a learning process that goes with it.
Okay. And it's really interesting. I had the experience of bringing someone to the table who we absolutely knew would try to blow our strategy out of the water. And the whole point was to get the opposition to raise their issues in a public place. And by the time we managed the process in the way we wanted, and they tried to sabotage it, everybody was tuned in. And we had a lot of support in managing the challenge. Okay, but you really have to think about this because some aspects of child welfare are very polarizing. Very polarizing. People have very different philosophical positions from many of the people in this room, and you've got to figure out how to manage it if you're going to advance the agenda. I love this definition of leadership. Getting extraordinary things done with ordinary people. And this sort of gets back to teamwork. It gets back to engagement. I just wanted to talk about leadership behaviors. One, the ability to formulate a vision for the future. And we think about that as a top-down process. But it doesn't mean that people sitting in the seats you're in can't have a vision for how your organization needs to change to meet the needs of kids. And you can promote it out and up and down. And over time, it will impact the formal vision. Got to be able, it's wonderful to have a vision. It's not so wonderful to have a hallucination. And the difference from my perspective between a vision and a hallucination is that a hallucination is really personal. In fact, we don't want to share it with anybody because they might think we were crazy, okay? But a vision is something that you want to articulate well and get the buy-in of others. And so if you're a leader, you do this big visioning stuff. If you're a formal leader, if you're somewhere in the middle, you begin to talk about your ideas for the future in a way that engages other people in the discussion. 100 years ago, when I was a direct service worker, we had a group of kids. We actually had one of the first groups of kids who were children in foster care that we sought adoption services for, because in the old days, they were just put in a caseload and ignored after a certain age. And so one of my colleagues said, you know, all of our kids are not doing well on speech and language. They were preschool kids, a lot of them. They're not doing well on speech and language and social skills. And it was in fact true. And she really, I watched her. She went from desk to desk to desk and had a campaign, literally, related to our need to do something different in order to get these kids to the right cognitive and verbal level. And by the time she finished campaigning, we all sat with her and developed a plan, and we gave it to the boss in full force, and she didn't have an option of saying no. Because this woman had really made a case with each individual and engaged each of us. And so we ran a summer program for the kids in which their language and cognitive skills developed incredibly in a very short period of time. But by the time we got to the boss, we had the plan, we had the problem, we had the strategy, we had everybody aligned in a network, and so her option was to say yes or have a whole lot of unhappy folk in this unit. So the ability to engage others, and again, really focused on the results for kids and families. Leadership is a bias toward action, that no matter where you are in the organization, you do more than looking at a problem. You really want to take it on. And we talked about this earlier, the ability to share success. Leaders don't care who gets credit. They just care that the job gets done. Okay, leading from the middle, which is what most of us have to do, requires us to facilitate the linkage between the front line and the people who made decisions. You were talking about communication and who makes decisions and whether those decisions are grounded in people at the front line and in clients. Leading from the middle, one of the best things you do is help people understand that make decisions, the street level, in terms of providing a service and working with families. So leading from the middle is always building this linkage between the practice and the community and the people who make decisions, and translating those needs. Sometimes you have to translate the needs of the administrator to people at the street level. Why are we doing this? Okay, why are we counting these beans? Because the feds say we have to. You've got to put that stuff in context. And this last point, I think, builds on the discussion we were having earlier about influencing your own spheres of domain, that every unit in an organization can be a laboratory for change. It can be used to demonstrate new practices, innovative strategies, new ways of linking to others. And leading from the middle, you have to integrate your informal power with whatever formal power you have. So you need to link your expertise and your relationships to whatever authority you have. That becomes important. Oh, I love this one. You're going to be a good leader from the middle. You've got to understand what makes your boss tick. No, I'm serious. Because you have to, it's like the strategic communication. You have to understand what the motivation of the boss is and make your case in the context of that motivation. If your boss wants to look good, you don't quite say this will make you look good, but that's what you communicate. If your boss wants to move up the hierarchy, you want to give them something that enhances their visibility and their performance. But really understanding that if you have a boss who doesn't want to change anything, and some of us do, that is a challenge. So you have to present your idea in a way that moves change but doesn't threaten that boss's need for stability. Does this make sense? Reno Patty's done a really, it's an old article called Leading from the Middle. And he talks about really trying to understand, is your boss a status quo person? Is your boss a climber? Is your boss an innovator? And as you understand that, then you shape your strategy and your communication so that it's something that a boss can accept. Is it useful? There you go. Status quo, climber, innovator. Those are the possible motivators of one's boss. In closing, and am I pretty much in time? Okay. Okay. Importance of alliances. Again and again and again, don't go out on a limb by yourself. Make sure you've got partners and co-collaborators and co-conspirators in the work you're doing. It not only supports you, but it expands the base for change. Second point, and we talked about this, is the tipping point. Change is a process. It's not an event. And so you can begin to see change strategies. And over time, if people are excited about them and they see the results, the change strategy takes on a contagion and begins to spread. So don't be discouraged if you can only get 2 or 3 people to do it. Those 2 or 3 people will influence the people around them. But understand that it's a process, and what you want to do is to build more and more connections in that process so that eventually it begins to take on a life of its own. Timing. We had a discussion about opportunities earlier. Timing is everything. Timing is everything. That when you seize an opportunity, when you see it, you're in a period of flux, in a period of crisis in an organization. That's a time when a little bit of influence goes a long way. So you've really got to pay attention to the timing as an opportunity. We talked about this, strategic communication. Frame your message so it will be heard. And it may have to vary by audience, but the message needs to be the same so that you have integrity, even though you're talking to different audiences in different ways about the same idea. That speaks for itself. Change doesn't happen overnight. Persistence is really important. And then let me say, we need to learn from our failures. Failures are lessons. They're not disasters. Occasionally they're disasters. But they're lessons. And when we try something and it doesn't work, we need to take a few minutes and figure out why it didn't work and what we might do differently. I mean, I got a whole lot of lessons on my lesson board about things where the timing was wrong or the approach was wrong, but those are the kinds of lessons that help us build our skills. Yeah, I
you
know
have
exactly
to you have
what
to be
you're
in a
saying.
learning environment where it's okay to make a mistake, or it's okay to say, we went with this decision, but in retrospect we should have considered X, Y, Z. That's a healthy environment.
Sure.
But there are some environments where a mistake can kill your career.
Sure. See, I think this gets to really a point that hasn't been raised up to this point, which is about how much risk one ought to take. And I like to think about us taking reasonable risk, that we want to take enough risk to bring about change, but we don't want to take enough risk that if we fail, there's a disaster. So there's something in here about measured and balanced risk-taking as we do all of this. But I would say to you that even in an environment, and I'm not so much talking about a punitive environment, but even in an environment that doesn't reflect on what they've learned, we as individuals can reflect on what we've learned from the things that worked and the things that didn't work, okay? You know, I remember having to go to remove 2 kids I placed. And I also remembered when I was going to get those kids, because there was an abuse in the adoptive family. I remember the moment where something didn't feel good in my gut about that family, but you know, the pressure was on to place. And so I didn't pursue my intuition. Okay, and that was a powerful lesson for me, because there was this little something that didn't feel right, but by God, we had a family for 2 kids at a time when nobody was adopting older siblings. And so we pursued it. But I learned to honor my gut. I learned to honor my intuition. So I think that even in a system that doesn't systematically review for lessons, we have an obligation to review what we've learned from our failures. Okay.
I wanted to ask a question in that same vein. With a new strategy, and you're having to determine a goal to kind of define your success, to me, what I struggle with is the different levels will have a different degree of what they consider success. And I'm wondering, is it the alliances that help spread what a success would be defined as for a new strategy? Or that's where I struggle, because I think my administration as far as what would be success is totally different than the frontline folks, the middle management. So I'm just wondering how you get the same success measure
all the way through.
Right.
All the way through. I think particularly when we're talking about practice change, we may need to have a measure of success that is not necessarily the system outcome, but links to that system outcome. Okay? And how you define what is successful will really depend a lot on your environment. So for example, I worked with an agency where they were trying to institute family group conferencing, and initially, you know, what they wanted to do was get everybody at the table. But very quickly it became apparent that they were diverting kids from placement. And so as they got more practice, they began to track the placement diversion, which became a much more systematic kind of measure. But I think you have to kind of feel your way out. But you can have intermediary measures that then link to the overall system measure. And you have to be asking the question, how will this change advance the ultimate outcome that we want to get to? Does that help? Okay. Yeah. Okay. The final thing is create small successes and celebrate successes. There is nothing more powerful for a group of colleagues than have somebody recognize their success. And often we're so busy moving that we don't take the 45 minutes or the half an hour that we need to say, look what we got done. And that becomes really important. And finally, both the potential and the responsibility for change is in each of us. And we just have to exercise the influence that we have. So thank you.